Good afternoon. I'm Jeff BIRDWELL, Director of the Huntsville Madison County Emergency Management Agency. It is Wednesday, March 10th. On behalf of Mayor Tommy Battle, Mayor Paul Finley, Commission Chairman Dale Strong, Huntsville Area Government, Healthcare, and Emergency Response Agencies, we bring you this weekly briefing on our community's response to COVID-19. Our speakers today will be Mr. David Spillers from Huntsville Hospital and District 6 Commissioner Violet Edwards from the Madison County Commission. You will note that we are sitting at least 6 feet apart, abiding by the CDC guidelines and our own best practices to sanitize and separate. I'll begin with the current numbers. Currently in the state of Alabama, there are 393,278 confirmed cases. In Madison County, there's 28,577 confirmed cases, having resulted in 369 confirmed deaths. Again, we continue to monitor the situation and respond accordingly. What I would like to do before we go to our first speaker is make everyone aware of a new service that is available related to COVID. The United Way is offering free rides to COVID vaccinations, and if you're interested in that, please just dial 211 to arrange those services. So at this point, we'll go to our first speaker, which is Mr. David Spillers from Huntsville Hospital.
Thank you, Jeff. Good afternoon. The information that I have to share with you today is positive. Hospitalizations of COVID patients is down substantially from our peaks in January. As of this morning in Madison County, we had 39 inpatients. That's the lowest number we've had since maybe October of last year. In Madison County, we only have 6 patients that are in the ICU and 4 that are on ventilators. Crestwood has 10 inpatients. They have 2 in the ICU and 2 on ventilators. And the numbers look good around the region. If you look at the rest of the region, there's only about 29 patients. In the rest of our hospitals, there's only 15 in the ICU and 10 that are on ventilators. So hospitalizations of COVID patients are down substantially. We can discuss what may or may not be causing that. Clearly, the vaccine, I think, is having a substantial impact for those people who are at high risk for hospitalization. And I think the way that the country and the state in our area has prioritized getting those people who are at most risk for hospitalization the vaccines first, it's probably having a substantial impact on the number of patients that are in the hospital with COVID. Statewide, the numbers also look very positive. Yesterday, there were only 478 new cases in the state. The 7-day average of confirmed and probable cases is down to 845. I have historically said as long as that number stays below 1,000, then we can probably manage COVID reasonably well in the state and in our communities. Right now, no hospital in the state of Alabama has a substantial number of patients where it's creating an issue. Huntsville and UAB continue to have the most patients, but even those are not at the point that they're disrupting normal operations. Because the COVID inpatients are down, our hospital operations are pretty much back to normal. We've resumed all elective surgery, urgent surgery. We are extremely busy because there was a lot of pent-up demand for that period of time, roughly 4 to 6 weeks, where we eliminated or postponed a lot of services. We're now working those people through the system. So a lot going on at the hospitals. In addition to that, the lovely weather gets people out, and we start having traumas and heart attacks from people who hadn't done anything in a year, those types of things. So we're getting a lot of the normal stuff that we get this time of spring. Vaccines. We are blessed that we're now getting 5,000 vaccines a week again. There was a period of time there when we were cut back substantially. That 5,000 vaccines are 2,500 new doses, 2,500 second doses. System-wide, we are approaching 100,000 vaccinations that we've given. It's close to 60,000 of those here in Madison County, so a substantial number of people have been vaccinated. We have no reason to believe we won't continue to get 5,000 a week. And while we're getting 5,000, you're probably well aware, many other organizations or entities in our community are starting to get vaccines, and they're becoming much more readily available. We've also been notified we're going to get some of the J&J vaccines, the one-shot vaccine. I think that's going to be a real benefit to many people. It's going to allow us to distribute vaccines to physician offices. One dose is just much easier to manage than the two-dose vaccines, and the vaccine itself is easier to deal with. And in the rural areas, I think it'll make a big difference in our vaccination rates in the rural areas. I got asked this morning, people are trying to, should I pick and choose which vaccine I try to get? I don't think it's wise to just wait on a particular type of vaccine. I think any vaccine at this point is the right thing to do. If it's Johnson & Johnson, get it. If it's Moderna, get it. If it's Pfizer, get it. Whatever you can get, go ahead and get vaccinated. The future vaccines, we're probably going to see some second dose shots come out for all, or additional doses for all the vaccines come out to try to address some of the variations of COVID that are developing in other parts of the world in particular. So don't be surprised if there's another round of vaccines. Hopefully they'll be much more readily available in the future when they do come out. I should mention that we still have over 20, well, I got the number a minute ago, 32,000 people on our waiting list for vaccines. We got way behind when that period of time when we got very few vaccines. And even at that waiting list, those are first dose vaccines we're waiting on. If we're only getting 2,500 new dose vaccines a week, it's going to take us quite a while to work through that number of vaccines. I think a lot of those people will start reaching out to pharmacies and physician offices and others to get vaccines from those as they are available, which I hope they do. Whether we vaccinate them or somebody else vaccinate them, the faster those 30+ thousand people get vaccinated, the better we all are. Based upon where we are right now with COVID, we have modified our visitation policy at all of our hospitals across North Alabama. I suggest that you look at the website of whichever one of our hospitals you may be attending, look at what their visitation policies are. We haven't gone back to the days of 10 and 15 people visiting a patient. I don't know that we ever will. I think we've learned a lot with COVID. One of the things we've learned is patients recover better when there are not people walking in and out of the door all day. It's easier for nurses to take care of patients when people aren't walking in and out of the door all day. Although some patients do need care from loved ones and they need the comfort of a loved one there, we'll always be able to manage that. But I don't think the days of having many visitors visit one patient in a day, we'll go back to that. Also been asked a lot about our mask policy. I expect our hospitals will continue a mask policy far beyond whatever happens on April 9th. We don't anticipate changing the mask policy in the hospital. Probably good hospital practice. Probably something we should have been looking at in the past. Flu season, for example, is a good time for people in a hospital to wear a mask. The last thing you want to do is have a loved one in who's in with some procedure, and you walk in and possibly give them the flu or give them something else. And a mask does help those things, and that's why we wear masks in hospitals and always have. So no change to our policy for masking, no matter what happens on the 9th. And to be determined what our long-term masking policy will be. I'm very excited about where we are right now. Haven't been this optimistic in a long time. Looks like COVID nationwide is getting to a manageable level. I think what's going on in some large areas like the state of Texas just saying we're kind of let everybody go back to where they were pre-COVID. It'll be interesting to watch that. I think we'll all learn from that. May work, may not. If it doesn't work, then we'll learn from that and figure out what we need to do and how we need to transition a little slower. If it works, then I think you'll see other states follow that. The only concern, or the concern that I have, is these mutations or variations of COVID there's all kind of studies being done to determine, do the vaccines, how effective are they against these variations? It appears that all of them have some degree of protection against the variations. But in some cases, the South African is the one that comes up most often as one that it appears that the vaccines that are currently available aren't as effective on that as we would like. So I think we've got to just keep an eye out for what happens with these variations. I think back to a year ago when we were sitting here and COVID had just started. Where we are today started with one person getting COVID, and one person to two to 50, 50 to 250, et cetera, et cetera. That's kind of the way this thing replicates. So I'd hate to see a variation of COVID come out that's totally vaccine resistant, and it just we get back to where we are. I don't think any of us would want to go through that again. So I would err on the side of caution. While I think there are many things we can do today we couldn't do in December and January because of where we were in COVID, I think people have many more options of things they can do. And if people are vaccinated, then they can more reasonably get together. But I would still caution people to use some thoughtfulness when you get together. Not everybody that you're going to get with will have had a vaccine. Keep that in mind. I think masks indoors are still extremely beneficial. So I would definitely do that. And we're still very hesitant to get large groups of people together in a contained area for a long period of time. Just the thought of doing that just creates some concerns with us. So if you got large groups, make sure they're in very large ventilated areas. And the shorter the period of time they stay together, the better off everybody will be. The last thing I'll address is staffing. Our staff and they've all done just a phenomenal job throughout our system, throughout COVID, is the best it's been in a long time. We have somewhere around 60 or 70 people system-wide that are dealing with COVID or COVID-related issues. Small number compared to the 15,000 plus employees we have in the system, so a very manageable number. So I'll just close by saying everything's positive. I think, again, pay attention. It could, if we move too quick on certain things and aren't careful and thoughtful about how we ease back into a more normal way of living, we could get ourselves in trouble. But right now, I'm fairly optimistic. Thank you.
Thank you, Mr. Spillers. Now we'll go to District 6 Commissioner Violet Edwards from the Madison County Commission.
Thank you so much, Mr. Birdwell, for the invitation to speak today. Good afternoon. My name is Violet Edwards. I am the Commissioner of District 6. I have the distinct honor of representing the 6th District of Madison County. And I was asked to share a little bit about the program spearheaded out of the District 6 office, as well as to share my thoughts about COVID vaccine and the hesitancy that we've seen some in the community. So when I took office, we were in the middle of this pandemic, and we needed a strategy to address all of the challenges. And the District 6 office has adopted a simple motto. You see something and you come up with a plan of action and you do it. So we moved forward to assist the community by focusing on 3 central tenets: safety, education, and COVID-19 relief. And to name a few of our efforts in regards to safety, we partnered with the EMA to provide 500 reusable masks to seniors and their families with children over the holidays. We partnered with Huntsville Hospital and Thrive, Alabama to provide free COVID testing at the Bob Harrison Senior and Wellness and Advocacy Center. In regards to relief, District 6 is currently working with other commissioners and designing a program that will offer $5.2 million in federal assistance for rent and utility payments for those financially impacted by COVID. And in regards to education, we partnered with the North Alabama Community United in Action in forming a COVID task force. And from this task force, a dozen of us, community leaders, ministers, and elected officials, participated in Huntsville Hospital's vaccine campaign and recording videos encouraging people to get the shot. The district has also hosted virtual panels with medical professionals to separate the facts versus the fiction when it comes to taking the vaccine. And we did this to engage all parts of the community with panels both in English and in Spanish. So though we can see the light at the end of the tunnel, now is not the time for us to slow down. This is about community. We wear our mask for our community. We socially distance for our community. We get vaccinated for our community. And while we have surely turned the corner in this pandemic, it's not over. We must continue to stay vigilant in order to beat this. So we have to remember that the 500,000 people who have lost their lives to this virus is not just a number. Those are loved ones who are no longer with us. And my truth right now is that my 72-year-old father is battling COVID. Right now, he can't walk from one room to another without sitting down and trying to catch his breath, and it breaks my heart. That is the truth of the Edwards family right now. And it feels awful, but it feels just as bad as it did when my uncles and my two cousins were in the hospital fighting the virus last month in Jefferson County. And it feels just as painful as when we got that call in the middle of the night in December from my mother-in-law being rushed to the hospital, positive with COVID, and she was found passed out in her floor. So personally, I can say I hate COVID. It has robbed so many of us of so much. And while I might feel like a helpless cousin or a helpless niece or a helpless daughter, I realize there is something I can do. When it's my turn, I will take the COVID-19 vaccination. It is my small part, my small way to protect my family and my community. And I hope that you will join us, not in just taking the vaccine for yourself, but that you continue to stay safe, that you educate and provide relief. It's the only way we can continue to protect ourselves, those around us, and to keep our community safe. I love you, Dad. Thank you for your time and attention.
Thank you, Commissioner Edwards, and thank you for watching today. We'll be back here again next Wednesday, March 17th at noon for another weekly briefing. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As always, as you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Good afternoon, everyone. My name is Elizabeth Gentle. I'm with WAFF 48. Violet, this is a question for you. As one daughter to another, I understand about having sick parents dealing with COVID, so I hope that your father improves. I have a question for you. A couple of weeks ago, it was mentioned here at this COVID briefing, there was hesitancy within the African American community to take the COVID-19 vaccine. Why do you believe there is that hesitancy, and what would you say to people who, regardless of skin color, who may have hesitancy in taking the vaccine to protect themselves from COVID-19?
I believe the data, and so there was a question of whether or not that data was even accurate, and I do believe that. And I say that if the hesitancy was there, it was just a trust issue, just science and going back years and years. But I think at this point right now, we should look at the data of the COVID vaccine and know that it can be trusted, that we have to put those fears aside. Don't forget about the past and anything else that you've heard, but we have to be vigilant and we have to be mindful today in moving forward to protect our family now. And so as I've gone out, I just say, educate yourself. Don't take my word for it. You can Google it, Oogle it, call somebody. Find out what is good for your family, but don't just brush it to the side because of history. You know, we can change today, and let's do so.
Thank you, Violet. This next question is for David Spillers. There seems to be still some caution in your voice when it comes to talking about, we have the vaccine, the numbers are down, but it seems as though there may still be some caution as to what's around the corner in the next few months, perhaps this fall, about a possible, maybe another surge. Talk to me about any concerns that you have with that and preparations ahead in case there is another chance that those numbers could go back up to a level that is concerning.
I just think it's wise to be cautious. As I mentioned earlier, this whole thing started with one person having COVID in Wuhan, China. I think whether we have another surge, based upon everything I'm reading, and you can read the same stuff I read, I mean, it's out there. Whether we have another surge or not really depends upon how well the vaccines do against the variations of the virus that the vaccines were designed for. If the vaccines continue to be reasonably effective against all the variations, then I don't think we'll see another surge. If not, then we could possibly see another surge. Vaccines are going to be readily available to people in the next couple of months. So I think everybody who wants a vaccine will be able to get one. When you combine the number of people who are getting vaccines with the number of people who've had vaccines, we're looking at a substantial number of the population who should have a good immunity to the current virus. So I'm not worried about the current virus. I'm worried about what may happen with the mutations of the current virus. And I think that's, like I said, I don't think we should stop doing what we're doing, and we need to try to move back something more normal in a very thoughtful fashion. But let's just don't forget what got us here, and make the same mistakes again, and not, if something all of a sudden there's a variation out there and a lot of people are getting sick, we should react quicker this time than we did last time as a country to kind of contain it, work on making sure those people get the testing they need and the vaccines they need and the modifications to the vaccines for the variants and those types of things. I think we've learned an awful lot this year. I hope we don't repeat the same things again if we have another strain pop up.
Thank you.
Bridget Divers with Way 31 News. This question is for you, David Spillers. So with St. Patrick's Day next week, a lot of bars downtown are having deals there. I know one bar starting at 8 a.m. to allow people to come in. Are you concerned at all that after a year of the COVID-19 pandemic and with warmer weather that people are going to lessen up what we're supposed to be doing, wearing masks, wearing 2 masks? Are you worried that we're going to see a spike in a couple weeks because people are going to just forget what they're supposed to do?
I think when people look at where we are today, most people see us on the downside of COVID. Most people are ready to throw away the mask and they're ready to go out to dinner and do the types of things that they used to do, and I think people will do that. If people go out and do that and they get COVID and they never show up in the hospital and clog up the hospitals with people who are on ICUs and vents and dying, it's a much more manageable process. And I wouldn't be surprised if that happens. I wouldn't be surprised if we see an increase in cases because of St. Patrick's Day, and if Texas might see an increase in cases. If we have protected those people who are most vulnerable and would end up in the hospital, then it's a totally different situation. We had this conversation, I think it was just yesterday we were talking. If a year ago, everybody was getting COVID and nobody was showing up in a hospital and we didn't see people dying in hospitals with COVID, it would have been a very different virus. That was the problem with this disease. Many, many people got very sick and many died. Again, I think the effort to vaccinate people who are most vulnerable and most likely to end up in the hospital will hopefully keep that from happening following St. Patrick's Day. I think the tragedy is going to be today, almost all of us know somebody who was a healthy individual who had really no complications, no comorbidities. They got COVID and they died. It wasn't a high number, but it happened enough where I know people like that, and that could still happen. You might not be in a high-risk group, but you might be one of those people who just don't react well to this disease, and some people don't. And some people are going to end up with lifelong medical issues related, I guess, as a byproduct of COVID, and we don't really know what all those are. So that's some of the stuff we don't know about. But
Okay.
I'm less concerned about hospitalizations.
Okay, and so with the new normal for hospitals, I know we're allowing 2 visitors. What do you think will be the highest amount we're going to ever see again for visitors in a hospital, because you're not just going to let people come all day, every day to have visitors.
I think it's, to be determined. I think a best practice going forward, having more than 2 people in a patient room at any time is not a good thing. Rare circumstance, maybe end of life when you got some family members there, you're dealing with something like that. There's a newborn baby, something like that. But in most cases, I would see 2 visitors, no more than 2 visitors at a time, is probably a pretty good policy. Now how you rotate 2 in and 2 out, and that type of thing, so they're not all hanging out by the nursing unit. You got to figure all that out too. But no, I would predict the new norm will be fewer people visiting. And we got to figure out how to manage that and how to communicate that and get people comfortable with that.
Okay, thank
A
you.
little time for that one.
Brian Lawson of H&T. For Mr. Spillers, we've talked before about scaling up. The hospital could do that as patient loads increased. I wonder, as you talk about meaningful increases in vaccine supply, can you do more vaccinations through Huntsville Hospital, or is that going to be more satellite kinds of operations? What volume can you guys handle versus having to outsource that?
So when we had access to vaccines at our south location near John Hunt Park, we were doing 2,000 a day, and it worked really well. People had to wait in their car just a little bit, but I think most people walked up to the door, they walked in, they got vaccinated, they sat there 15 minutes, and they left, and it worked really well. So we have the capacity to do massive numbers of patients if we have access to vaccines and want to do it that way. I candidly like the idea of you going to your primary care physician and getting one when you go there, being able to get one at pharmacies at Kroger and the independent pharmacies in town, urgent care centers. I think wide-scale distribution of vaccines where people can get them and get an appointment to get one within 48 hours would be ideal. And I think we'll be there. I think we'll be there by May or June, candidly, at the rate their vaccines are coming on the market and being distributed. So we could go either way. If they want us to do them, we'd be glad to do them. But I think just from a ease of getting one standpoint, I'd like to see many more outlets doing vaccinations, not just us.
This is for both Commissioner Edwards and Mr. Spillers. You mentioned it's been a year. I kind of can't believe that, but here we are. I wonder, as you reflect back on the past year, I imagine a ton of images come to mind, but can you mention, if you don't mind, a few things that stand out to you both about the year we've just seen? What's staying with you at this point?
Well, it has been, and time's flown by, but it's also felt, when you're in the middle of it, it felt like 3 or 4 years. It was pretty intense there for a while. I think what stands out is, hindsight. In hindsight, everything's pretty clear. If you would have asked us in March of last year, what would we do if Huntsville Hospital Health System had 600 COVID patients, I wasn't sure we knew. I didn't know if we could take care of that many, because I didn't know if we'd have respirators and ventilators and supplies and all this type of stuff. And then lo and behold, in January, February, late January, February, we had those. We had 600, and we were managing okay. We had to quit doing some electives and urgent surgeries and those types of things. We had everything we need from a supply standpoint. Everything changed. I think the one thing that stands out in my mind is just how well our community and our hospitals, and I'll give our system hospitals a lot of credit, have worked well together that nobody in this room and nobody on TV has seen. The daily phone calls where Hospital A says, I'm inundated, I got too many patients, and Hospital B, which is not Huntsville, most people think all the transfers come to Huntsville. One of our other hospitals said, hey, I can take 3 patients, and another hospital said, well, I can take 2. And we distribute patients to different hospitals to even the load and make sure everybody's getting the appropriate level of care. Same thing happened with vaccines, same thing happened with supplies. nobody saw that going on. But from a system perspective, I did, and I was extremely proud of how the team responded. You know, early on, we realized testing was an issue. The team put up a testing clinic that could see 500 people a day and do 500 tests a day, I think in about 48 hours, staffed, ready to run. Vaccination clinics, as soon as we got word we were getting vaccines, we were ready to vaccinate thousands of people. So the teamwork and the quality of the people, that's the thing I'm most proud of and the thing that stands out most over the past year.
Thank you.
So in reflecting on 2020, everyone talks about how bad it was and how just thank goodness we're past 2020. And as I think of 2020, I remember both the bad and the good. I saw the best come out of people. So while I saw my children sitting at the table pulling their hair out while we try to figure out this online virtual classes, I saw mothers texting and emailing the teachers trying to keep them encouraged. I saw people pulling together to serve food at the schools to make sure that the children still ate. I saw churches all across the city come together and put together food boxes. And while we were encouraging seniors to stay at home because they were in danger, I saw millennials and the Zoomer generation get out and deliver those foods and pass it out. And I saw people go out of their way to go to the poll. So I remember the bad, but I choose to focus on the good. And I think that 2020 probably brought out the best in a lot of people.
Thank you.
At this point, we'll end the press conference. Thank you for coming.